Hip thrust series, level 1. So with the hip thrust series level 1 exercise, what you want to do is make sure you start with the pelvis in a neutral position. So it's a perfectly neutral position. Keep that pelvic alignment neutral while you reach up with the hips. You're going into hip extension by contracting with the glute max. You're keeping the entire spine one line, one perfectly aligned position. You're keeping the pelvis neutral, so you don't want to go into anterior pelvic tilt or excessive posterior pelvic tilt, bringing the butt way under. Your neck will go into flexion, this position here, as your body goes up, of course, because some joint is going to have to move. And in this case, it's going to be the cervical spine that flexes a little bit. But pelvis stays neutral, spine stays aligned. It's crucial in this exercise you maintain the neutral pelvic position for the entire way that you're bringing the pelvis up until you get into this full extension position. And it does help proprioceptively if you keep those hands on the pelvis to help guide you in feeling where's the neutral pelvic position, and even more importantly, if you're making some compensations along the way. For fitness doctor practitioners, sometimes doing that hip thrust series level 1 exercise can bother the client's neck. It's important to know because as they begin to place their whole body load and stress right on the cervical spine and going into flexion, for many clients this cannot quite agree with their cervical spine. So a modification to that exercise is actually have them lay on a plinth or on a massage table and adjust the headrest into a lower position. You can see I'm going into extension here, but by the time I get into full range of hip extension, my cervical spine will be back towards a neutral position, which is ideally what you want. So we're going into the exercise with the client. We're keeping a neutral pelvic position. We're coming up, keeping that neutral pelvic position as high as they can go. And notice that my cervical spine is near a neutral position, and you can of course adjust the headrest to whatever position you want or need to, so that once the client's in full hip extension, that their cervical spine is about neutral. Much easier on the neck in this position, having that head hang off the table, than being on the floor smashing the chin towards the chest.